Hello, my name's Adrian Riggs from Kesson Physiotherapy. In today's video, we're going to address the issue of how difficult it is to get a GP appointment in some places these days. And when you do get an appointment, you often only get a 10-minute slot with your GP. So what we want to, the question we want to address today is how to get the most out of your 10-minute GP appointment. So we've got a local GP, Dr. Greg Price from Margate, to help us answer some of these questions about that very issue, getting the most out of your 10-minute GP appointment.
Hi.
All right, thanks very much, Dr. Price, for coming along. Right, first off, I've just got my appointment, I've turned up. What information should I prepare before I get to my appointment?
So that's a really helpful question because I think that there's quite a lot you can do to get the most out of your 10 minutes. Yes. In fact, I saw a poster recently about how if you, a GP surgery did an experiment where they laminated little cards that just had 3 questions on it. And they asked the patients, just while they were sitting there in the waiting room, to prepare in their minds the answers to 3 things. One is, what is the main thing that's bothering me? Like, what's the main thing that I want the GP to prioritize today? So that's the first. And then the second thing is, how is that bothering me? How's that affecting me? What is it about that problem that I want them to fix? And then the third question is, exactly what is it I'm hoping the GP will do as a result of my visit today? And being clear about the answer to those 3 questions is really helpful. When that surgery did a satisfaction survey, it found that patients who had prepared answers to those 3 questions almost uniformly finished their consultations with a much higher level of satisfaction. And interestingly, so did the doctors. The doctors also much preferred it.
All right. So the 3 things to focus on are being clear up front about what it is the main thing you want to do.
What's the main issue?
What's the main issue?
How's it bothering you? And what you want the GP to do about it.
Okay, great. Thank you. And also, sort of kind of related to that, is when I get to my point, is having a list of information helpful?
Well, it can be. So there are lists and there are lists.
Right.
So one of the really helpful things that you can do is to do a little bit of research and to know a little bit about your condition before you go and see the doctor. Yeah. A lot of people worry that if they've done a bit of Googling or they've done a bit of research about their condition, that they worry that the GP will react badly to that somehow undermines their professionalism or something. It doesn't. It's fine. In fact, I find it usually quite helpful, so long as you're doing that in a rational kind of a way. Yeah. But so long as you've done a little bit of research, I actually often find that really helpful because it allows me to talk about the condition in a more educated kind of a way with you. So that kind of a list or that kind of a bit of information is really helpful. The unhelpful kind of list is where sometimes patients have, and we affectionately refer to it as a shopping list of different kind of issues. And they perhaps want the GP in a 10-minute consultation to go through 4, 5, 6 different things. And the reality is, when you do that, you're only giving them a chance to spend like a minute on each of those problems. And they have to either just dismiss those issues or gloss over them. And neither of that's very satisfactory for either of you.
Okay. No, I get that. And then what information does you as a GP really need to know to make an effective plan of action for me?
So those 3 questions are really helpful. Yeah. But in particular, it's quite helpful to go into a little bit of detail about how it's bothering you, particularly. Yeah. So, what effect is it actually having on your life? Why is this such an issue? What's the reason that you've come to see me about it now?
Right.
So one of the things I learned as a doctor quite early on was to work out, okay, so this patient's had this issue for, I don't know, months, years, sometimes. What is it about the issue that's made them come to see me today? Because actually that is a really crucial piece of information. So that's really helpful. Yeah. And then it's also really helpful for that third answer to those questions is what is it you really want me to do about it? Because actually, to be truthful, a lot of the time I can't actually solve the problem as a GP. I can't, a lot of the diseases we diagnose, we can't just cure. So what we're realistically going to do is to help you manage with the symptoms or help control the disease in some way or the other. And so actually, if you're clear about what it is you're hoping that I'm going to be able to do for you about that, then that helps us both feel like we've achieved what we needed to in the consultation.
Okay. All right, good. And then Yes, and so if I come in with a clarity of what I want you to talk about with you, my condition, what I'm hoping you will do, give you that information. What questions should I be asking as a patient of my GP?
Well, I mean, really, you can ask anything you want, can't you? In a way, that's the whole point of seeing a GP. But I suppose one of the things that I find quite helpful that sometimes patients do, particularly towards the end of the consultation, is that they check with me that they've understood what we've gone through. And that's a really helpful thing to do, because, you get to the end of the consultation, and to be honest with you, sometimes as a GP, I get so used to saying things and explaining certain things that I can cover like a lot of ground in a short space of time. And it's actually, sometimes I kind of forget just how much I'm expecting the patient to remember in that 10-minute consultation. And so actually I think it's really helpful if the patient at the end of it sometimes will say, okay, so doc, this is what you think is going on, this is what we're going to do about it, or, this is the investigation next, and the next steps for me are this, this, and this. Have I got that right?
Yeah.
Because actually, so often when patients do that, I realise that perhaps I've explained something too quick, or I've forgotten something, and it's actually a really helpful thing just to check that they kind of got it, that they know what we're going to do next.
So that summary at the end is really helpful to just underline for both the patient, so that they bought in and understand what they've got to do.
Yeah.
Similarly, you know that they've taken on board all the important elements that you're trying to get across in those 10 minutes.
Yeah, absolutely. And and to be honest, don't feel shy about doing that, because actually, if you've not got all those bits of information, that's more a reflection on me as a doctor than it is on you, the patient, isn't it? Actually, really, that's about me wanting to confirm that I've explained things to you properly.
Yeah. Just going back to the issue then, it is only 10 minutes. You've got a lot of there's not a lot of time rather to sort of go over everything. What happens if I come to you with a condition that I feel is serious or complex and will take longer than 10 minutes? What do you do in that sort of situation?
So there's a couple of different approaches to this. And actually, to be honest, it's worth just saying that or explaining that a bit to the receptionist when you first start booking the appointment.
Yeah.
Because actually, a lot of the more modern, forward-looking GP surgeries around can offer you more than just 10-minute appointments. Okay. There's often flexibility. Like, quite a lot of the time, it's possible to book a double appointment. You might have to wait longer to get the double appointment, but actually that's one of the options that's available to you. You can ask for a double appointment. Can't necessarily say that they will always be able to do that. But similarly, if you explain that it's a complex issue and so on, often the receptionist will pass that information on to whichever GP it is you're likely to see. And things that I've done in the past, for example, is I've put that patient at the end of my appointment list so that I can overrun and not make all the other patients late. Okay. Or sometimes we will just book a longer appointment. So like just today I had a patient who was really complex, and actually we booked a 30-minute appointment for them because they needed some real time. And it is possible to do that, and some surgeries will do that better than others, but it's certainly it's a perfectly reasonable thing to ask at reception. Like
so mention it up front rather than at the time of the appointment. Mention it before, so that, like you say, the GP is prepared and knows what's coming. Okay, all right, good. And just look at a practical session. Obviously, you will see a range of patients with a range of issues and a range of conditions. What should I wear as a patient coming to my GP appointment? So
I think the first rule is wear something you're comfortable in. Yeah. For heaven's sake, don't feel like you have to dress up to see a GP. But also, it's useful to wear something that allows us to examine the important body part in question. If it's about a knee, wear something that means that we're going to be able to get the close up, have a look at the knee, that sort of thing. And it just makes things a little bit easier and a little bit quicker.
Okay, all right, thank you. And then, going back, we've only got 10 minutes. Are there any absolute no-nos that I as a patient shouldn't do to waste precious appointment time?
Yeah, so I think... I'm going to say no, there's no real no-nos, because actually I think it's really important that people feel like they can raise anything with their GP, or like whatever it is you want to discuss, you can bring it up. Yeah. But in a way, I also think it's important to try to give your issues the time and space that they need, and to give the GP a chance to help you properly. And the thing is, I go back to that shopping list thing. If you've got 5 or 6 issues that you want dealt with in a single consultation, the reality is you're just not giving either of you a chance to do that properly. And so I would suggest maybe if there's one thing not to do, don't do that.
Yeah.
But by all means, if it turns out you've got other stuff that you need to discuss, or you can always book other appointments.
Yeah.
And you can always say in an upfront way, like right at the point of booking the appointment, actually this is going to be kind of complex. Is there a way that we can make this a slightly longer appointment? And I think that's legitimate.
Okay. Great. That's been really helpful, and I hope the people listening have found that useful, so that when they go to their next appointment, they make the most of their time there. So thank you very much, Dr. Price, for giving us those useful insights. Thanks very much.
Anytime.